I got a message last week from a student who had just failed the NCLEX for the fourth time. Fourth time, she wrote, I don't know what else to do. I've done over 2,000 practice questions. I've read every rationale. I can tell you everything about every disease. I study 3 to 4 hours a day. But every time I sit for the exam, I fail. And I don't understand why.
2,000 practice questions. That's not a study problem. That's something else entirely.
That's what I told her. I said, you don't have a knowledge problem. You have a reasoning problem. And she said, but I know the content. I can answer questions when I'm studying at home. It's just when I'm in the exam room, I freeze. And that's when I knew what was happening. She was pattern matching instead of reasoning.
Meaning she'd memorized 2,000 question patterns. But the NCLEX doesn't test pattern recognition. It tests clinical judgment. So when she saw a question that didn't match a pattern she'd memorized, she had no framework to fall back on.
Bingo! And this is what most students don't understand about the NCLEX. It's not a knowledge test. It's a reasoning test. Let me show you what I mean. Here's a knowledge question. What are the signs and symptoms of hypoglycemia? That's recall. You either know it or you don't. Now here's an NCLEX style question. A patient with type 1 diabetes reports feeling shaky and sweaty. Blood glucose is 58 milligrams per deciliter. The patient is alert and able to swallow. What is the priority nursing action?
Same topic, hypoglycemia. But the question isn't asking you to list symptoms. It's asking you to apply clinical judgment in a specific scenario.
Right. And here's where students get stuck. They see hypoglycemia and their brain immediately goes to everything they've memorized about hypoglycemia. Signs and symptoms, shakiness, sweating, tachycardia, confusion, seizures. Causes: too much insulin, not enough food, increased exercise. Treatment: if conscious, give oral glucose. If unconscious, give IV dextrose or glucagon. And now their working memory is full. They've used up all their cognitive space trying to recall facts. So when they look at the answer choices, they're not reasoning through priority. They're trying to match what they memorize to what they see on the screen.
And if the answer choices are all technically correct interventions for hypoglycemia, they panic. Because they're trying to remember which one is the right answer, instead of reasoning through which one is the priority for this specific patient in this specific moment.
That's it. And that's why students who know the content still fail. Because the NCLEX doesn't reward memorization. It rewards reasoning. And here's the really frustrating part for students. The more facts you try to cram into your brain, the worse you get at reasoning on the exam. Because your working memory is full of recall and there's no room left for thinking.
So the student who studies 5+ hours a day doing practice questions is actually making the problem worse. They're reinforcing pattern matching instead of building reasoning skills.
That's the trap. And that's what this episode is about. Why the NCLEX tests thinking, not knowledge. How to recognize the difference. And how to actually prepare for a reasoning exam instead of a recall exam. Because once you understand what the NCLEX is actually testing, everything changes. Welcome to the Think Like a Provider podcast. I'm Jenna Way, nurse practitioner and educator. Here we don't memorize, we understand. Each episode, we break down clinical reasoning, system by system, so you walk away thinking and acting like the provider you are meant to be.
And I'm Alice, here to help bridge concepts and ask the questions you're probably thinking.
So let's break down what the NCLEX is actually testing. Because once you understand the exam's logic, you can stop fighting against it and start working with it.
And more importantly, you'll understand why your current study strategy might be sabotaging your success.
What the NCLEX actually tests. Here's what most students think the NCLEX tests. Do I know enough content to be a safe nurse? And that sounds reasonable, right? You want nurses to know what heart failure is, what sepsis looks like, how to give medications safely. But here's the problem with that logic. If the NCLEX just tested knowledge, it would be a matching game. You'd memorize facts, regurgitate them on the exam, pass, and become a nurse. But knowing facts doesn't make you a safe nurse.
Because in real life, you don't get multiple choice questions. You get a patient in front of you with incomplete information, time pressure, and consequences if you're wrong. That requires judgment, not just knowledge.
That's the key. So the NCLEX doesn't test what you know, it tests how you think. Specifically, it tests something called clinical judgment. And the National Council of State Boards of Nursing, the organization that writes the NCLEX, has a very specific definition of clinical judgment. They break it into 6 cognitive skills: recognize cues, analyze cues, prioritize hypotheses, generate solutions, take action, evaluate outcomes.
So instead of testing, do you know what sepsis is? They're testing, can you recognize early signs of sepsis in this scenario? Analyze whether it's the most likely diagnosis, prioritize the most dangerous possibility, generate appropriate interventions, choose the right action, and evaluate if it worked.
Yes, that's clinical reasoning in action. And here's why this matters. You can know everything about sepsis and still fail the sepsis question if you can't reason through priority. Let me show you what I mean. Knowledge versus reasoning, side-by-side comparison. Let's take the same clinical topic and show you the difference between a knowledge question and a reasoning question. Knowledge question: what nursing school tests? A patient with sepsis may exhibit which of the following signs? Select all that apply. A. Fever. B. Tachycardia. C. Hypotension. D. Tachypnea. E. Altered mental status. This is recall. You either memorized the signs of sepsis or you didn't. All 5 answers are correct. NCLEX style reasoning question. A patient admitted 2 days ago for pneumonia has been receiving IV antibiotics. Today, the nurse notes the following: temperature 101.8 degrees Fahrenheit, heart rate 118, blood pressure 94/58, respiratory rate 24, oxygen saturation 91% on 2 liters nasal cannula. The patient is difficult to arouse and responds slowly to questions. What is the priority nursing action? A. Increase oxygen to 4 liters nasal cannula. B. Obtain blood cultures and notify the provider. C. Administer PRN, acetaminophen for fever. D. Reposition the patient and encourage deep breathing.
All 4 answers are things a nurse might do for this patient. So it's not about knowing interventions, it's about knowing which one to do first.
That's it. And here's how students get this wrong. A student whose pattern matching sees fever, tachycardia, hypotension, and thinks sepsis, and looks for the answer that says give antibiotics. But there's no antibiotic option, so they panic. Then they see oxygen sat 91% and think patient needs oxygen and pick A.
But that's treating a symptom, not addressing the underlying problem. The patient is septic. The priority is confirming the diagnosis and starting definitive treatment, not just bumping up the oxygen.
Right. The correct answer is B. Obtain blood cultures and notify the provider, because blood cultures need to be drawn before antibiotics are started or changed. And the provider needs to know immediately that this patient is deteriorating so they can adjust the treatment plan. But a student who's memorizing patterns instead of reasoning through priority won't see that logic.
And this is why doing thousands of practice questions doesn't always help. If you're just memorizing sepsis equals blood cultures, you're still pattern matching. You're not building the reasoning skill to prioritize in novel scenarios.
That's the problem. And this is why students who know the content still fail. They're studying for a recall exam, but taking a reasoning exam. The anatomy of an NCLEX question. So let me break down how NCLEX questions are actually constructed. Because once you see the pattern, you can start thinking like the test writers instead of fighting against them. Every NCLEX question has the same structure. 1. The STEM, the scenario. This gives you clinical information about a patient: age, diagnosis, current status, recent changes, assessment findings. 2. The question, what they're actually asking. This is where they tell you what kind of clinical judgment they're testing. Priority, what should the nurse do first? Assessment, which finding requires immediate follow-up? Evaluation, Which statement indicates the teaching was effective? Analysis. Which of these findings is most concerning? 3. The answer choices, the trap. Here's the key. All 4 answers are usually correct interventions or assessments for that patient. The NCLEX isn't testing whether you know correct versus incorrect. It's testing whether you can prioritize.
So students who are looking for the right answer versus the wrong answers are approaching it all wrong. They need to be looking for the most important answer versus the also correct but less urgent answers.
That's the shift. And that shift is everything. Let me show you what this looks like in practice. Real-time walkthrough. How to reason through a question. I'm going to walk you through a practice question step by step, showing you the difference between student thinking and provider thinking. Here's the question. A patient with chronic heart failure is being discharged home. The nurse is providing discharge teaching. Which of the following statements by the patient indicates a need for further teaching? A. I'll weigh myself every morning before breakfast. B. I'll call my doctor if I gain more than 2 pounds in a day. C. I'll take my diuretic at bedtime so I don't have to get up during the night. D. I'll limit my sodium intake to less than 2 grams per day. Student thinking, wrong approach. Okay, heart failure, discharge teaching. What do I remember about that? Daily weights? Yes. Call doctor for weight gain? Yes. Sodium restriction? Yes. Diuretic. When do they take that? Let me think. I remember something about bedtime. Or was it morning? I can't remember. I'll guess C.
They're trying to recall memorized facts instead of reasoning through the logic of each statement.
Right. Now here's provider thinking. This is asking which statement shows the patient doesn't understand. So I'm looking for the incorrect statement. Let me evaluate each one. A. Daily weights before breakfast. That's correct. Consistent timing before eating. B. Call doctor for 2-pound gain in 1 day. That's correct. That indicates fluid retention. C. Take diuretic at bedtime. Wait. That doesn't make sense. If you take a diuretic at bedtime, you'll be up all night urinating. Diuretics should be taken in the morning or early afternoon, so the peak effect is during waking hours. D. Limit sodium to less than 2 grams. That's correct for heart failure management. So C is the incorrect statement. That's the answer.
You didn't try to remember, when do heart failure patients take diuretics? You reasoned through it. What would happen if I took a water pill at bedtime? I'd be up all night peeing. That's not safe or practical.
That's clinical reasoning. You're thinking through cause and effect instead of trying to recall a memorized fact. And that's what the NCLEX rewards. Why practice questions fail most students. Now let's talk about practice questions, because most students are using them completely wrong. Here's what students typically do. Read question. Pick an answer. Check if they got it right. If wrong, read the rationale. Move to next question. And they think, if I do this 5,000 times, I'll pass the NCLEX.
But that's just building a database of memorized patterns. You're not actually practicing clinical reasoning.
Right. So here's how you should actually use practice questions. Step 1. Read the question and identify what they're testing. Are they testing priority, assessment, evaluation, analysis? This tells you what kind of reasoning you need to use. Step 2. Before looking at the answer choices, answer the question yourself. What would you do in this scenario? What's the priority? What are you most concerned about? This forces you to reason before you see options that might bias your thinking. Step 3. Look at the answer choices and eliminate based on reasoning, not recognition. Don't ask, which of these have I seen before? Ask, which of these addresses the priority? Which of these treats the cause versus the symptom? Which of these prevents the most dangerous outcome? Step 4. If you get it wrong, diagnose your thinking error before reading the rationale. Don't just read why the correct answer is correct. Ask yourself, what was I thinking when I picked my answer? What did I miss in the question stem? What assumption did I make? What priority framework should I have used?
You're training yourself to think like a test taker and a clinician at the same time. You're building the reasoning skill, not just collecting correct answers.
That's the key, because the NCLEX will give you questions you've never seen before. But if you've built the reasoning skill, you can apply it to any scenario. The priority framework that works for every question. So let me give you a framework for prioritizing that works on almost every NCLEX question. When you're trying to decide between multiple correct answers, ask yourself these questions in order. Question 1. Which answer prevents death? If one answer addresses a life-threatening problem and another addresses a comfort issue, life-threatening wins. Example, patient with chest pain and nausea. Do you give pain medication or do an EKG? Because chest pain could be an MI and you need to rule out life-threatening causes before treating symptoms. Question 2. Which answer addresses the underlying cause versus the symptom? Treating symptoms might make the patient feel better temporarily, but it doesn't fix the problem. Example, patient with heart failure has shortness of breath. Do you raise the head of the bed or give a diuretic? Diuretic. Raising the head of the bed helps with breathing. Symptom. But diuretic removes the excess fluid. Cause.
Though in real life, you'd do both. But on the NCLEX, when they ask, what should the nurse do first? They're testing whether you can identify the intervention that addresses the root problem.
Right. Question 3. Which answer uses the nursing process correctly? Assessment before intervention. You can't fix a problem you haven't identified. Example, patient reports dizziness. Do you assist them to sit down or check their blood pressure? Check blood pressure. Assessment first, then intervene based on what you find. Question 4. Which answer follows ABCs? Airway, breathing, circulation. If multiple answers are addressing different systems, prioritize in order of what kills fastest. Example, patient in respiratory distress with low blood pressure. Do you give oxygen or start an IV? Oxygen. Airway and breathing come before circulation.
So instead of trying to memorize the right answer to every possible scenario, you have a framework for reasoning through priority, no matter what the question asks.
That's the goal, because you can't memorize every possible NCLEX question, but you can learn to reason through any question using a consistent framework. Common NCLEX mistakes and how to fix them. Now let me walk you through the most common mistakes I see students make on the NCLEX and how to fix them. Mistake number 1, reading too fast and missing key details. Students rush through the question stem, see a familiar diagnosis, and jump to the answer choices without fully reading the scenario. How to fix it. Force yourself to read the stem twice. First time, get the overall picture. Second time, highlight or mentally note key details, age and diagnosis, current status versus baseline, recent changes, specific assessment findings. These details matter. They change what the priority is.
For example, patient with heart failure reports shortness of breath is very different from patient with heart failure reports sudden onset of severe shortness of breath. The word sudden and severe change the urgency and the likely cause.
Absolutely. Mistake number 2, picking the first answer that sounds right. Students see an answer choice that's correct and pick it without reading the other options. But remember, all 4 answers might be correct. The question is, which one is most important? How to fix it. Read all 4 answers before choosing. Actively evaluate each one. A, this is correct, but is it the priority? B, this is also correct, but does it address the cause? C, this treats a symptom, not the problem. D, this is the priority because it prevents deterioration. Mistake number 3, overthinking and second guessing. Students pick the right answer, then talk themselves out of it. This seems too obvious. They wouldn't make it that easy. Let me pick the more complicated answer.
But sometimes the obvious answer is the right answer. The NCLEX isn't trying to trick you. It's testing whether you can apply clinical judgment.
Right? So here's my rule. If you've reasoned through your answer using a priority framework, stick with it. Don't change your answer unless you find new information in the question stem that you missed the first time. Mistake number 4, letting emotions override logic. This is huge. Students see a scenario that triggers an emotional response. A pediatric patient, a cancer patient, an end-of-life situation, and they pick the answer that feels compassionate rather than the answer that's clinically correct. How to fix it? Separate clinical judgment from emotional response. Yes, you should be compassionate, but on the NCLEX, the priority is safety and clinical appropriateness. Example, pediatric patient in pain, parent is distraught. Do you comfort the parent or assess the child's pain level and give medication? Assess and medicate the child. The parent's emotions are valid, but the priority is the patient's physical need.
The NCLEX is testing your ability to function as a safe, competent nurse. That means prioritizing clinical needs, even when it feels uncomfortable to not address the emotional needs first.
Right. And in real life, you do both. But on a priority question, clinical safety wins. Mistake number 5, not trusting the nursing scope of practice. Students see a question and think, I should call the doctor for this. But the NCLEX is testing independent nursing judgment. If the answer is notify the provider for every question, they're not testing your clinical reasoning. How to fix it? Ask yourself, what can I assess, identify, and intervene on independently before I need to escalate? Abnormal vital signs, assess further, then notify the provider. Patient education need, teach first, then evaluate understanding. Symptom management within nursing scope, intervene, then document and report. Notify the provider is usually the right answer when new life-threatening symptoms appear. Assessment findings are outside your scope to manage. Orders need to be changed based on new information, but it's rarely the first action. Assessment comes first. What to do the week before the NCLEX? All right, so you've been studying using reasoning instead of memorization. You've been practicing questions the right way. You're 1 week out from the exam. What do you do? Alice, what do you think students typically do?
Panic. Cram. Do 500 questions a day. Stay up late reviewing content they're weak on. Exhaust themselves mentally and physically right before the exam.
Yep, and that's the worst possible strategy. Here's what you should actually do. 7 days before. Stop doing new content. You know enough. Do 75 to 100 practice questions per day, focusing on reasoning through your wrong answers. Identify your weak areas, not content areas, but reasoning errors. Are you missing priority questions, analysis questions, evaluation questions? 3 days before. Cut back to 50 questions per day. Review your most common reasoning errors. Practice your priority framework on 10 to 15 questions to reinforce the pattern. 1 day before, do not study. Seriously, do something relaxing. Go for a walk, watch a movie, cook a meal. Get everything ready for tomorrow, your ID, authorization to test, directions to testing the center, snacks for breaks. Go to bed early.
Wait, no studying the day before? That feels wrong to students who are terrified they'll forget everything.
I know, but here's the truth. You will not learn anything new the day before the exam that will make a difference. But you can absolutely exhaust your brain and tank your performance by cramming. Your brain needs rest to perform at its best. Reasoning requires cognitive energy. If you're mentally exhausted from cramming, you won't be able to think clearly during the exam.
So trust the work you've already done and show up mentally fresh.
That's it. What to do during the exam. Now let's talk about the day of. You're sitting in the testing center, you start the exam. Here's what you need to know. The exam adapts to you. The NCLEX is a computerized adaptive test. That means the difficulty adjusts based on your answers. Get a question right. Next question is harder. Get a question wrong. Next question is easier. And here's what freaks students out. They feel like they're getting really hard questions, so they think they're failing.
But actually, hard questions mean you're doing well. The exam is testing whether you can perform at a higher level.
Right. So if you feel like every question is difficult, that's a good sign. It means the exam is pushing you to demonstrate higher level clinical judgment. Don't panic. Just keep reasoning through each question one at a time. Use the break. You get a break after a certain number of questions. Take it. Stand up. Walk around. Drink water. Eat a snack. Clear your head. Don't sit there and ruminate on the questions you just answered. You can't change them. Let them go. Don't try to predict your result. Students try to count how many questions they got. I'm at 120 questions. Does that mean I'm failing? Stop. You can't know. The number of questions doesn't tell you anything about your performance. Just focus on the question in front of you. Reason through it. Pick your answer. Move on.
And if you get cut off at 85 questions or 150 questions, don't assume anything. The exam stops when it has enough information to determine whether you're above or below the passing standard. That can happen at any point.
Right? So just trust the process. Answer each question to the best of your ability. Use your reasoning framework and let the exam do what it's designed to do. Here's what I want you to take away from this episode. The NCLEX doesn't test what you know. It tests how you think. You can memorize every disease, every medication, every nursing intervention, and still fail if you can't reason through priority in the moment.
And the students who pass aren't necessarily the ones who know the most. They're the ones who can apply clinical judgment under pressure.
That's the truth. So if you've been studying 10 hours a day and still failing, you don't need to study more. You need to study differently. Stop memorizing patterns. Start building reasoning skills. Stop reading rationales passively. Start diagnosing your thinking errors. Stop doing questions to collect right answers. Start doing questions to practice clinical judgment. Because the NCLEX rewards reasoning, not recall. And reasoning is a skill, which means it can be learned, which means you can learn it, but you have to practice it like a skill, not memorize it like a fact.
And that's exactly what clinical reasoning is. It's not about how much you know. It's about how you think through what you know.
Right. And that's why I created Think Like a Nurse and Think Like a Provider. These aren't content review courses. These aren't question banks. These are clinical reasoning systems designed specifically to teach you how to think like a provider, which is exactly what the NCLEX is testing. You learn the priority frameworks. You practice reasoning through cases. You diagnose your thinking errors and fix them. Not through more content, through better thinking. You can find the link in the show notes. And if you're looking for community, a place where you can practice this with other nursing students who are preparing for boards the right way, be on the lookout for the Think Like a Provider School community. It's a community that's going to change the way you approach the NCLEX and nursing. We work through NCLEX-style questions together using reasoning frameworks. We identify common thinking errors. We build the skills that actually get you through boards. The link to join the waitlist is in the show notes as well.
Everything you need to stop memorizing and start reasoning is right there.
But for now, I want you to try this. The next time you do a practice question, before you look at the answer choices, ask yourself, what is this question actually testing? Priority, assessment, evaluation. Then answer it in your own words. Before you look at the options, see if that changes how you approach the question.
Because once you understand what the NCLEX is testing, you can stop fighting the exam and start working with it.
And that's when everything clicks. Thanks for listening. I'll see you next week.
See you next week.